All right, guys, so today we're gonna be talking about the truth about Botox. Yeah, it's the most common plastic surgery procedure that everyone knows about, but do you really know everything about Botox? Stay tuned, today we're gonna talk all about it.
Today is facial plastic surgeon and rhinoplasty expert, Dr. Deepak Dugar.
Okay, so we're talking about Botox today, and we're going through all the truths and demystifying all the myths. So the first thing that everyone always asks is
it a poison?
That's right, is Botox a poison? The answer is technically yes, but the same way Tylenol or Advil is. Tylenol is a poison, Advil is a poison, but it's a dosage dependent poison. So if you do Botox in the right dosage, you're not gonna die from it, or you're not gonna get botulism. But if you do too much of it, you could have an injury or a serious problem. So the key is doing dose-dependent Botox. And most doctors would never describe or prescribe amounts of Botox that would hurt you. The question will be, will they do too much in your face to make it freeze? Which brings us to the next question.
Does it freeze your face?
It's like it's frozen or something.
Oh, this. I got a Botox injection today.
Botox treatment.
Botox. They take a big needle and inject it into your forehead and it freezes your face like this. I read it in a health magazine.
That's right. Does Botox freeze your face? The answer is it shouldn't, but it usually does. The reason is because Botox is like an art. Most people think of Botox like Tylenol. You pop a pill, you swallow it, and you get a result. That's not how it works with Botox. It's a craft art that's based on the skill of the injector. So if it's a very skillful injector, they'll preserve the motion in your face while letting you still have decreased wrinkles and expression lines. But if someone's not as experienced and they inject too much, then they usually freeze the face and you lose all expressions. To give you an example, I actually have Botox all over my face and I can still move every part of my face. Eyebrows, smile lines, every expression is preserved because we do very low dose Botox whenever we do it. All right, let's continue with your questions.
Is it reversible?
So yes, the question is it reversible? It's a very good question. The answer is technically it's not reversible, but it is temporary. So Botox usually lasts anywhere between 3 to 6 months, depending how much was injected. It is not reversible though. So once you get Botox, you cannot go back until it wears away naturally.
How does Botox work?
Okay, good question. So they're asking, how does Botox work? Botox works in a very specific manner. It's not actually a drug that does anything to your skin or muscle. What it does is it prevents the release of acetylcholine from the nerve junction. So it doesn't allow the muscle contraction to happen as strongly. So what we do is we inject tiny doses to weaken the muscle so that it softens the muscle motion without freezing it.
How long does Botox last?
And how long are you going to be like this?
Well, this is temporary. And then you got all your wrinkles are gone.
Great question again. How long does it last? So generally it lasts 3 to 6 months depending where you're injecting it. In low baby dose Botox, which we always recommend, it can last anywhere between 2 to 3 months, which means you have to get repeat dosing. The reason that's important is because during that time frame, you preserve the natural motion and expression in your face. If you do higher doses of Botox, it will last longer, but for the first couple of months, you might look a little frozen or weird.
Where can you use Botox?
All right, great question. Where can you use it? So can you use it beyond your face? Yes, absolutely. Botox actually is used for tons of things. Everyone knows it today as the cosmetic medication application, but it actually didn't start with that. It started way back before in the eyes. Yeah, Botox being shot in the eyes for people who have strabismus and they have awkward motion of their eyeballs. That being said, the actual use of Botox for cosmetics was purely accidental. Just like the concept of chocolate was. It's an accident that the scientists realized as a side effect of the Botox injection, they were seeing less expression lines in the face. It wasn't until 2002 when Botox actually got FDA approval in the United States for cosmetic indications. And since then, it has boomed. Over $2 billion in revenue every year from just Botox alone for the company that distributes it, Allergan. So the concept with Botox is that cosmetic use is the most commonly known one. There's actually over 100 uses of Botox by doctors across the world, some of them on and some of them off label. Off-label means that it's not technically FDA approved for that, but doctors are allowed to use it because the drug itself is FDA approved. It's used for things from sweating, so people are using it in the armpits to prevent sweating. It's used in places like the forehead and the back of the head for migraines, to help reduce migraines. It's even being used now for depression. Studies are showing that people who get Botox more regularly versus placebo injections have less depression. So there's all types of uses of Botox, and then that's not even talking about the full body uses beyond the eye or the bladder.
Any long-term hazards?
That's a great question. So we're asking, are there any long-term hazards of Botox? The great reason I love to tell people that there's no long-term risk with Botox if it's injected properly is the studies that were done long ago with kids who had what's called torticollis. Basically, they had these giant strains in their muscles, their sternocleidomastoid muscles, where they can't move the muscle because the muscle's so enlarged. And these doctors are injecting huge doses of Botox to shrink down the muscle size over time. These kids were followed over the next 30 to 40 years and found to have no repercussions systemically based on the Botox injection. The injections that we inject cosmetically are so much smaller, there's no risk of long-term side effects from doing Botox in terms of systemic side effects.
What are the short-term side effects?
So of course, you can have the normal side effects like bruising, bleeding, things like that. But the biggest side effect with Botox is an unwanted cosmetic result. So people, if they inject too much in the brows, can drop a brow. If you inject too much down here in the depressor anguli muscles, you can actually make your smile awkward. When people try risky uses of Botox, like doing lip flip procedures or trying to treat gummy smiles, while they are effective, they're very risky. You can end up with an asymmetric smile. And again, those don't go away until 3 to 6 months when the Botox wears off. So the biggest side effect of Botox is really improper injection technique. And so that's why it's very important if you're doing Botox to find a skilled injector. But you know what? We're talking way too much about Botox. Let me go find a patient and let's show you exactly how it's done. I'm just gonna mark a couple things. So we wanna keep your brows exactly the same shape.
Yeah.
And so what we need to do is inject it light and then raise it one more time real big. Really light and smile real big. So here's the thing. So with the brows, if you only inject it.
I think this brow's always been higher than the other one.
Yeah,
so
just a little bit.
Is
You're
there
right.
any way you could like lower it? Or-
So lower it or bring this one up just a little bit.
Okay.
Because I think that's a safer option.
Okay.
Because if you lower this brow, it can have alternative effects, okay? So if you lower it, the goal is to lower the whole brow. But if you lower it, what can happen is you don't lower the whole brow, you just lower the peak.
Okay.
And then it becomes flat and it doesn't look cute.
Okay.
So instead, what I would say is let's do a dot here. And this extra dot I'll do here will help lift your brow up just a little bit more. And then it'll even it out.
Alright.
And smile real big one more time. So and the reason I'm doing a dot here, let me explain it to you. It's not because you have a bunch of lines. You don't need this. We're doing a dot here because this will adjust the brow so it won't move or will move more on this side.
Okay.
But this side, if you just do Botox here, your brow will come down.
Okay.
So you do a dot here to adjust it. This frontalis muscle, you're learning all your anatomy right now. So the frontalis is the only lift muscle of the brows.
Okay.
This muscle, orbicularis oculi,
oculi.
or is it those? Yeah, oculi. This, when you smile, it pulls your brow down.
Okay.
So weakening this will lift the brow, weakening this will drop the brow. So that's how you balance it, okay? So net, the brow stays the same shape on this side, but this side we're gonna lift it just a little bit.
Okay.
All right, guys, I hope you enjoyed this video on Botox and hope you learned a little something about how it's not technically a poison. But any questions you have, please let us know below. Like, comment, and subscribe, and we'll keep pushing more videos towards you.